Welcome to Epic Conquerors. Your host, Dr. Judy Bauer and Chad Smanjack. You are epic. Everything is possible in Christ. The battle is real. The victory is assured.
Welcome to another episode of Epic Conquerors. We're so delighted that you're with us for this particular part 2 of dealing with back pain and spinal issues. We're so blessed to have our guest with us, Dr. Ron Fudala, and he and I are good friends, and we've known each other for a few years now. We've been watching each other's journey in our respective fields, and it's such a blessing to have him do this little 2-part mini-series with us on our podcast. So, Brother Ron, it's so good to see you again. And go ahead.
Yeah, it's great to be here. And you mentioned how it goes back to where we met, a couple years ago and became friends. And it's my pleasure to be on this with you and watching you, because you have always inspired me with your dedication to do what you do, with the message that you bring, and with the genuineness with which, you carry yourself. And so, it's...
Wow,
we're
that
lucky.
was nice.
Yeah, we're lucky to have certain people in our lives. And,
Yeah.
and I certainly feel fortunate that our paths cross.
Oh, thank you so much. I feel the same. I've enjoyed watching your journey so much. And I love your posts when you do your motorcycle rides. Hey, that's such a blessing. And I'm going to hold you to it, like I said in the last episode. But anyway, you live in Florida with your wife of 40 years now. You guys have been married. We got you beat just a little bit. We're going to come up to 54 for us in next month. So my goodness, I'm telling you, that's incredible how that happens.
Yes. How did we get here, right?
I don't even understand that,
Yeah, actually, and it's not the same as 50-something years of marriage, but in February, I am now a Medicare enrollee. As I am filling out those papers and talking to people on the phone, I'm thinking to myself, no, I'm not.
Can this be real? I know, right? But now I use it to my advantage. I ask, is there a senior discount? And then they'll look at me and I go, yes, because I'm very senior.
give them all to me.
I'll take it all. But anyway,
Ron,
you guys live in Florida. Can you share with our listeners a little bit about what you enjoy about Florida? And have you always lived there?
Oh, sure. We raised our family in Cincinnati, Ohio. And
what
we
a
have
big difference.
Boys. Yeah, 4 boys. They go from 38 to 28. I grew up in Southwest Pennsylvania. My wife near Philadelphia. We met at Penn State. And so 6.5 years ago, we moved down to St. Augustine, Florida.
Did you get tired of the snow or what?
Yes, and our third son played baseball at a college down here.
Oh,
so I've been coming down and fell in love with the area. And had gotten a little bit tired of the practice I was in, with the demands of it, the pace of it, a lot of the politics of it. And that's what led me to resign and devote time to putting together Spine Camp, or the Spine Camp program. But in Northeast Florida, it is nice. It's right now a little bit chilly. We're going to be moving into where the weather begins to get warmer. But even though it's chilly, it's not chilly like it is in Cincinnati.
No, not in any way, shape, or form. Not at all. Well, we've been having such a great discussion on our last episode that we did, and now this one, our second part 2 on dealing with back pain and spinal issues. And Ron, for those of you that didn't catch the first episode, is a board-certified chiropractic neurologist, and he's practiced and been a consultant in spine and nerve diagnostics as a consultant since 1993. He's got a lot of experience, years of it. And we're so blessed to have him on this episode to talk to us about back pain and spine pain and how we deal with it. And on our last episode, we kind of concluded with the concept of how we are responsible for our health and well-being, and how our health issues are a continuous process all throughout our life. You can't just think, okay, I applied this one situation and my back feels better, or whatever part of your body, so now that's finished. No, because we're constantly having wear and tear on our bodies. We're constantly doing different things. So talk to us about that analogy you shared with me before we started recording. I thought that was so good.
Right. So many people that I've worked with, both online and in my practice, feel that if their back is hurting them, then something must be wrong or bad. Or if a treatment they had received in the past helped them to overcome an episode and their pain came back, then that treatment must have failed. Meaning that they look at their back as, if it's fixed, it'll never bother me. It only bothers me if it's bad.
Ooh, I almost need you to say that again. We think if our back is fixed, it should never bother us again.
Right.
Isn't that the craziest thought? But we have that thought.
We often do have that thought. And our backs, our spine, it is interesting. The spine is very complicated. And in some of the sessions, my online digital program, I talk about what the spine does and I simplify it.
Oh, beautiful.
Basically, the spine is designed to put some other part of our body in a position to do something. So if we lean forward and reach, our spine has to allow us to do that. If someone is kicking a football and one leg is off the ground, not only are we supported by our leg, but imagine if our spine continued to move when that leg moved to kick. You would not have any force. So the spine is designed to efficiently put our body in a position to do some purposeful activity.
Wow, I like that.
Yeah, and the spine, because of that, it always has strain on it. Any structure, if the forces on it are great enough, more than that structure can bear, it's going to be compromised or hurt in terms of the spine. So you can have an excessive force on a very healthy spine that may damage it. You can have a less excessive force on a spine that might be structurally less sound, or you can have things that occur over the years repetitively due to the things we do every day, like sit improperly, constantly bending, without ever doing things to try to reverse that sustained stress. So if it's stress,
so it's important what you just shared there, because I know myself, I sit in the chair a lot because I write and study and do the different things and do podcasts. And so, but to do the things that will put that back into place, that's a really good point you're making right there.
Right, and the whole idea is that if we looked at our spines like we looked at a vehicle, we use them, there is strain on things just like the brake on a car. If you're using the brake, you're eventually going to have to replace those brakes. You have to change the oil and do the lubrication to keep it running properly. And one of the biggest reasons that people continue or walk down that path of chronic pain that gets harder and harder to take care of is they don't look at their bodies like they do a car. Yeah. So if they did, and if you're driving down the road and you heard a squeaky wheel, how many people, if that wheel was squeaking real bad, would turn up the radio so they couldn't hear the wheel squeak? And the louder it got, the more they turned up the radio to just hide that annoying squeak. Yet so many people today, when something's going on in their body, and in particular their spine, and this is true with pain medication, let's say, or even injections, and not that either one is bad, but those basically turn up the volume of the noise to hide this.
That's a good analogy, yeah.
Yeah, they don't take care of it or address the underlying reason that may be occurring. And you can get by with that for a little bit, but if it's done again and again and again, and you ignore that, just like that wheel's going to fall off the car, then sooner or later someone is going to have a bad spine. And that's when it gets to be very, very hard to get back under control, to be as functional as most people would like it to be.
It's just like in anything, we always seems to, anyway, in our humanity, we want to just not bother with something until we just can't deal with it anymore. And then we start to deal with it then, and it's sometimes too late.
Right.
We had an issue with my husband had some skin cancer on his head. And for months I've been telling him, you need to go look at that. And it was very small at that time, but over the few months he didn't want to get it looked at. Now it grew to the size of like a 50-cent piece, a large thing.
Yeah, right.
That required a 2.5 hour surgery to
Oh
pull out
my.
all of that, all the way down to his skull, and then pull his skin up on this side and front and back and side to side. He's
Right.
suffered a lot for that. But
Yeah.
if he had done it in the beginning when it was like the size of the tip of a pencil eraser, it wouldn't have been nearly as hardcore to deal with it.
Right.
But that's the same kind of analogy why we continuously do that as people, putting things off, when if we would just look at it at the get-go and start taking preventative measures, we could really save ourselves
Right.
a lot of pain and anguish. Yeah.
And I hope your husband's doing okay now.
Yeah, he's in his
everything.
second week now since that, and it's beginning. I can see it's healing nicely, but
Yeah, not like a typical guy to ignore things, not wanting to
I know,
sit.
right?
Yeah. We
But us
sometimes
girls
don't-
do it too, I gotta say. We're all
I
guilty.
know. But yeah, it's, and I mentioned to our second oldest son the other day, who's 34, and he works with the Marriott Corporation as a rooms controller. And he does great at work, but he tends to let personal details go unattended to. And we talked about, look, don't let little things become big things.
Yeah.
That little thing that's right in front of you that needs to be done, take care of it.
Get to it.
Do it now. Because that little thing will be a big thing if you put it off, and it will never become a big thing at a good time.
That's it. Oh, that's it. And then to take care of that big thing, it's so much more painful than if we would have taken care of it in the beginning. So this is all good analogy for everything in life. This applies. People, let's take care of things when they're small. And like there's an old saying, this little foxes spoil the vine. It's kind of that same idea, right? These little things, if we just ignore them, they continue to grow and expand, and pretty soon it does become a thing. And take care of it.
Well, and that's what we talked about too a little bit the last section, is that, we have to accept a part of the responsibility for it, because we like to procrastinate or hide. But the system is not set up to help people know what they need to do, to give them the guidance, to answer the questions, to let them know how to take care of themselves so it doesn't become a big thing, because you're in an office, you're out of an office, you're a little bit confused. And so, we tend not to get the instruction that we need to be able to take care of those little things with the back as they occur.
Like you shared, the doctors are highly incentivized to do certain kind of things, and we as the patient, we want the quick fix so we don't, quote unquote, have to deal with it anymore. And so we set ourselves up for the perfect storm. Whereas what you're doing with Spine Camp, and I just love that so much. And for our listeners here, in our show notes on epicwinforyou.com, you'll see all the links and things, how you can get involved with Ron and work with him and so on. But I really encourage that. But what we're dealing with is how we can understand what's really going on and really pay attention to these things and deal with them before they become a big thing.
Right. And to do that, it really becomes simple. Now, if you look at the spine and if you look at the biology of it and all the research that's done, it's very interesting if you're an academic. And I enjoy academics.
Well, like you blew me away on the last episode that there's 250 different ways that you could treat.
250. And we talked about, the Spine Camp filling a need that's not there, which is to give impartial guidance, help people develop a roadmap if care is needed. But that roadmap starts with giving yourself a chance to see whether or not you need treatment or whether you really need treatment.
Yeah.
Or it can be taken care of on your own, and to offer you the tools to do that. But I call it the 3 B's that can create issues when people seek spine care. It's big, which we talked about, the bigness. It's bias, which we've talked about, where all those 23 different professionals have their own way of doing it. Science has never shown one way being better than another, but every professional thinks their way is the best way. So that's why
how they've been trained, right?
Right. And it's
that's
not
how they make their living. So that's going to be
right. Yeah. I mean, who is going to go in to see a chiropractor and say, no, in your case, I think medication would be a whole lot better than what I can do.
Right. Yeah.
Well, I think that type of chiropractic treatment is better than mine.
Yeah.
We're trained in our way of doing things. We're going to apply it the best we can. We're going to apply it and be well-meaning, but we're going to think we're right and the best. So when people go from one doctor to the next, they get all these different opinions, which leads to a lot of confusion, which can then lead to fear, which gets back into that negative spiral I just spoke about. And so that the third B is business, in that we are incentivized to treat, not to show you how you don't treat, but even things like MRIs. There have been several studies that have shown, for example, that a person's chance of getting an MRI or having a surgery is 5 to 10 times greater if their clinician has an investment in a surgical center or an MRI center. So there is a lot of income earning, revenue generating things that are being developed where there's a conflict of interest. Not that it's every doctor, it's not, but it's becoming more prevalent. And so all those recommendations that people get, well, maybe not all of them are based on science. Some of them can be based on revenue opportunity.
That's so important that you're saying these things. I really appreciate it, because it is important for us as the patient or the consumer, if you will, to pay attention to not just taking carte blanche, the advice or the counsel, because there could be a bias there. Like you said, there could be a business there, and there could be other components that really dictate the kind of information that they're giving you. So to me, that's right, what you do and why you've developed the system that you've developed to be able to look at things differently is so important, to kind of give us the information and the knowledge so that we can make an informed decision, and we can understand that one size does not fit all, that there's so many different ways to approach the issue and to bring health and healing to our bodies. But it's going to be a continual life process, because I think we talked about it in between our recordings that we're doing here, how we peak in our age and we come to our maximum potential, but then we start the downhill slide. Right. So there's a constant understanding that we need to face facts, that we have to take care of ourselves all along the way, and not just think that, well, we dealt with it once, that should fix it forever. So I think that's fantastic. You had some things that you shared with me about 4 things that will bring us mastery in this. Could you kind of share those 4 things?
Sure. And this is where it gets to taking all this science, which can be confusing and complicating, even though it's interesting, and simplifying it to what the essence is of what people need to know to help themselves or to choose care, make good choices in care. The first, there are 4 M's, is the mechanisms. And by that I mean mechanisms of pain or injury. And there are really only 3 mechanisms. There's stretch, and that usually occurs with some type of forward bending. That can either be repetitive, sudden and forceful, but also even sitting in a chair like we do, working over a computer. That's forward bending. That puts a stretch on structures. So there is stretch pain. Then there's compression pain. And that usually occurs when you lean backwards and joints come closer together. Imagine if you took your thumb, bent it backwards, and did it firmly, you would compress that side of the joint where you're moving that thumb towards. The same is true of the back elements of the spine, that they can get loaded. And if they're loaded improperly or too rapidly or forcefully, that compression can cause pain. And then the third is what I call friction. All the tissues in the body lay on top of, in between each other on various planes, and they have to slide and glide smoothly for our movement to be efficient. If there is a restriction in those tissues due to some mild scarring, due to some tightness in the connective tissue, it's going to affect movement. And that type of pain occurs when you move but it often responds very well to repetitive movement because you loosen up that tissue. So that's mechanisms. And the reason it's important to understand the mechanisms is there are only three. Knowing to identify your mechanism helps you to recognize and reinforce yourself against it. And it also serves as the foundation for the type of movements you would do to correct it.
Wow, that was so good. I took notes right there.
Okay.
So the first M is mechanisms, and then you go into metrics. What does that mean?
Metrics. Metrics means knowing how to measure progress. And not just saying, I'm good, I'm bad, but there are certain ways that clinical professionals and research measures progress. There are questionnaires that can be filled out. There are, depending on how those questionnaires are answered, determines on whether someone has made adequate progress or not.
And you have links on some of that?
Yes.
That'll be in the show notes that people could avail themselves of that.
Right, and they're very important and they're easy to use. And the reason that people need to know how to do it on their own, and one of the free signups on my site is for how to keep score. And I go through and walk people through step by step what the function and how to keep score, because that will help them measure their own progress, know whether they're making reasonable progress, be able to compare one treatment to another, and also have realistic expectations from any form of treatment, because they'll be able to see where that treatment kind of grades out on that, on that metric system.
As they always say in almost anything, know your numbers. And in the same way, it's just kind of...
It really is. It really, like for me in the stock market, they talk about all those different numbers, and I know people are looking at it today.
Yeah.
I don't understand any of them.
Yeah.
Okay. So I'm not as good an investor maybe as someone else might be that understands those metrics and numbers.
That's right.
But I understand the metrics of back pain, and that's what
I'm so glad.
Yeah, that's my job, and so I'll let someone else deal with the other stuff. That's not what I've been trained in.
Yeah, we each have our own niche, our own jam, our own passion, and that's what makes the world so beautiful. When we can tap into each other's giftings, then we get the benefit of the whole.
And thank goodness we do. It makes for a much richer, colorful world. But so we have mechanisms and metrics, and then we have movements.
Okay.
Now, far too many people become limited because they feel if they move and it hurts, then therefore it is bad and I am harming myself. I
think that's huge, Ron. Yeah.
Yes. There is a big difference between hurt and harm. Harm occurs when you put your body in a position where further damage to the structure can occur. Hurt can occur because there's inflammation there. You move it. The body doesn't like it, and at least initially, you're going to feel that hurt. So the one rule, and we call it smart movement, and use a system called motion response training. But smart movement is learning how to move in a way that's going to affect your pain positively. And motion response training uses 8 simple moves from 3 positions and follows one rule. And here's that one rule, because it's important. It doesn't matter how much pain a person experiences when they move the first time, but it matters how they feel when they move the 10th time.
Wow.
If they go through a movement repetitively, and if on that 10th movement, the pain is noticeably less, then that's a movement that can continue to be used. If they go through that movement, and let's say as you continue to do it, the pain gets worse and worse and worse, then you wouldn't want to use that movement.
Well, that's a good way to figure it out, right? Yeah.
Yeah, and people can use it on their own, but they first need to understand, wow, if I move this way and if it hurts, maybe I should continue moving, because these 8 movements, even if they hurt, none of them put a person in a position where it will harm their body. So not only does it help them alleviate their pain, but it lets them gain more confidence in knowing that movement isn't bad, and it can prevent that fear cycle from developing where they become more and more afraid and limited in what they do. because that often becomes a lifestyle.
I think this is so important, what you're sharing and the skill set that you have now to know how to talk about all these things and provide this kind of information and care, even for parents or grandparents with your children, teenagers, and so on. Teaching them these kinds of things as they move into life, I would imagine, could help alleviate a lot of the pains that we develop in our older years if we knew how to better care for ourselves in our early adulthood or teenage years. Yeah.
Yes, and we talked in the last episode about that triad, the physical, the intellectual, mental, and the emotional.
Yeah. Mm-hmm.
So let's say you have that young child and they have a parent or parents that have experienced back pain. And let's say that child has grown up with seeing those parents be more and more limited because of that back pain. And that child, adolescent, has their episode of back pain. What's the first thing they're going to think of? I am going to be like my parents, or my grandparents. So fear sets in immediately. And then they're going to go to a physician who, rather than shows them why nothing may be there to be overly concerned about, is going to say, well, I will fix you. And that's where that whole cycle develops, because each time that episode occurs, they're thinking, I'm one step closer to that really bad experience that I'm seeing in those people that are close to me and that I love.
Yeah.
So information can be the greatest treatment.
It really is. Knowledge is power.
Knowledge is power.
And when we understand these things, then we can, by faith and belief in them, move forward in a really great way. So we had mechanisms, we had the metrics, we had movements. So now we've come to mistakes. And nobody likes that word. Everybody wants to be perfect. We don't want to make mistakes.
Well, when we were first starting our venture together, some of the coaches I was working with, when I was talking about developing an online spine care program, and they talk about all these great transformations, and I go, well, what I do isn't necessarily mind-blowingly exciting. It's not like they're going to make a movie about it. I go, the best I can do sometimes is keep people from making really bad mistakes that are going to ruin their life. Yes. And they go, well, you can't talk about that. No one's going to find it interesting. And I said, okay, you're maybe right. So, but anyway, getting back to mistakes, that really is one of the best things any clinician or counselor can help someone do, is avoid bad mistakes. And here are a couple. Number one is making your diagnosis based on your MRI, or your treatment based on your MRI. Study after study after study has shown that what you see on an MRI, except in those handful of situations we talked about in the last episode, but nothing that you see on your MRI can tell you where the pain's coming from. Nothing that you see on your MRI can tell you what type of treatment is going to work for you. And if you did MRIs on 1,000 people over the age of 40, 45, 60% of them or more would have abnormalities, even if they never had a day of pain in their life. So it's a tool, but it is not the definitive tool that defines the diagnosis or the treatment. So that's one of the biggest mistakes people make. And research has also shown that, let's say someone has an episode of back pain, even if it's severe and limiting, that if they have an early MRI, their cost of care and chances of having surgery doubles compared to people who haven't had an early MRI, yet their outcomes are no different, if not worse.
Wow, fascinating. That's so important to know. I mean, we don't get to, quote unquote, hear these kind of things typically, because there's usually an agenda behind the information that's received. So again, to move us in a certain direction for benefit or gain. But in this situation, when we can understand some of these basics, we can really help ourselves so much, be very prepared to face what's ahead for us.
Right. And each person's situation is different. As you mentioned, spiritually, each person's life circumstances are different. And when they will experience discouragement is different. The same is true here. So this is just kind of a general framework. Yeah. And that's where working with a physician would know clearly if that MRI is needed because something is severe. They're But that's really, really rare. But it's so common to get that MRI early because the family doctor doesn't have the time to spend with you. And people also are trained to believe that, well, to find out what's wrong with me, I need to see it on a picture.
Uh-huh.
And I've seen so many people when I was in practice, and even when I'm consulting now, I'll say, well, tell me what's going on. And they'll say, I have a bad L4, L5 disc. I go, no. I don't want to know what your image looks like. Tell me what you're experiencing, when you feel it the most, how it limits you. The point is once people are told they have this bad whatever, they become what their image is. And every time they have another pain, they're wondering in the back of their mind, is this the time it's just going to let me down completely? And it scares them and restricts them.
This is so powerful what you're sharing because it applies to every aspect of life. But it is true, the information that we get really colors the way that we move forward in life. So it is important to get all the right facts so that we can make the right decisions on these things. When you deal with the mechanisms and then the metrics and then the movements and then understand that there's mistakes also that factor into all this, then that kind of all wraps up into what you call mastery.
Right. It's realizing
you have a game plan for your life.
Exactly. That you have the confidence of knowing that if a situation arises, you can apply your intellect, your movements to see if you reduce it and control it and not rely on someone else. So you're able to get up in the morning most of the time, and you can't say all of the time, but you're able to get up knowing that no matter what happens, I'm going to be able to get through the day. I'm going to be there for the people who need me. I'm not going to allow myself to be overwhelmed by fear to where my life becomes more and more limited, because once you cross that line where you've become your MRI, where you're always looking for someone to fix you, where you're afraid that every single movement you make is going to cause you to fall apart, it's hard to get back. And you give up so many things that you would otherwise be able to do. And life is not, it's not enjoyable for people that cross that line.
So good. I hope our Epic Conqueror community hits the replay button on this episode and listens to all this again, because what Ron is sharing with us is so appropriate for not only our healthcare, but in every other kind of area of life. These are just basic principles and strategies that apply to a lot of things. And I'm really grateful that you're sharing all this. If there was one thing that you could think of, Ron, that would be a part of solving some of the problems that we face in our spine care system, what do you think that would be?
It would, I think one thing that would solve it is if there were a professional in the system whose only incentive was to counsel you and to help you understand the metrics, to understand the treatments, and to work you through the process without having a financial interest wrapped up in your care. And there are probably some clinicians out there like that. Now, outside of that, and I never want to infer that the professionals are selfish or in it for their own interest. By far, the majority want to do what's right for you.
Absolutely, or they wouldn't even be in that profession.
Right.
Yeah.
So you at least make sure that you're working with someone who is going to take the time to look you in the eye and answer your questions and not make you feel less educated because you're asking them. You should never be embarrassed. And if you're working with that kind of person, as I said, nobody knows what's going to work when it comes to treating back pain, but at least you can trust that person. So that's good. But the second thing, and maybe the most important, is making sure you are able to do what you want to do the rest of your life. Starts with you, starts with me. Learn how to take care of your back. Learn that pain isn't necessarily bad. Understand the difference between hurt and harm. Rely on yourself first to solve these problems before you look for someone else to fix it for you, and avoid looking for that magic wand that's going to make everything go away without your effort. And the problem with that is that for every person who's looking for that magic answer, I promise you, there will be someone who's selling it too.
Yes.
So
Yes, there's always a snake oil salesman somewhere.
they're in every profession,
Yeah, absolutely. In any profession, in every profession, there's
right.
that. That's why it's so important to uncover people that can help us in our journey of life in whatever arena that is, but that we get well-balanced information so that we can make the right decisions for our own life, because life is a journey and it's a long one, Lord willing, and we want to live it to the fullest that we can and feel our best all the way through as much as possible. And taking care of our physical body has so much to do with it, because if your physical body isn't doing well, then you get grumpy, and so that affects a lot of things, and you just don't feel like doing things, so you're unproductive. I mean, it just snowballs into a lot of other things. So it's kind of like a basic premise. If we take care of ourselves health wise, and our spine and our back is kind of like the main piece of our body, right? It's what holds us all together.
Yes.
So it's really not something to discount or to take lightly. It is a huge component of our overall well-being.
Well, and it is to take charge and make the choices that we can make. Just as we talked, that no one's forcing us to believe in Christ or, you know, a higher power, but we have that choice. We have that choice to live our lives angry and feeling resentful, or to believe that we're going to live in spirit the best we can. And a next door neighbor of ours recently moved, was 89, 92, and my wife and I helped them get their house ready to move. But I miss her so badly because she inspired me so much, in that her hips had failed her. She had fallen and fractured one. 2 surgeries didn't work. She had to have a third. Anyway, despite all of that, she was up when she got out of the advanced physical care facility, was walking her dog on her walker, riding her little seated cycle, and never once did I see her feel sorry for herself.
Beautiful.
And I looked at her and I thought to myself, if ever there was a person who could lament what has passed her by and why things aren't the way they used to be, it would be her. And I thought about what struck me years ago in practice, is that when stuff happens to us, we have 2 choices. We can lament the way it was or the way we'd wish it to be, or we can make the best with what's in front of us. She's a person that made the best, and I'll always have her in my vision, seeing her do that.
That's so powerful. I always say you can have 2 choices. You can get bitter or better.
There you go.
You can decide
like
which way you want to go.
I like
And
that.
also that the sun, when it shines on butter, it softens it. But if it shines on clay, it hardens it. So the sun shines on both elements, but you get to choose. Are you going to be clay or are you going to be butter? So when life happens, like you just said, that's such a powerful way to conclude this particular little mini series that we're doing, is we have choices in life, how we face things in life. And that's what Epic Conquerors is all about, is facing things, getting the facts and understanding what's going on so we can fight them and we can conquer them and have the victory. And so that's fantastic. Well, we always choose in all of our episodes Epic Conquerors weapon, spiritual weapon to spotlight. And we've chosen for this little mini series faith and trust, because we need to have faith and confidence and trust in applying the knowledge that we get so that it can have the optimum results and benefits. And choosing to get better instead of bitter is like, goes right along with that, right? So
Yes.
that's going to be our epic weapon that we're spotlighting, is have faith and trust and confidence in God who made you, that he's got all the information that you need to maintain your health and well-being while you're here on the earth. He provided it. And I'm so grateful that he's given a lot of that information to Ron, and that you can help us in your spine camp. And for our Epic Conqueror community, in the show notes, when you go to Epic Win for You, the number 4 and the letter U, epicwinforyou.com, you'll see the show notes, all the links and the freebies that Ron has for you, that you can do these assessments, that you can find information, how to get a hold of him. I mean, it's fantastic. So go to the show notes and you'll discover all of that right there. Then in every episode, we also do this too. We have our Epic Conquerors power affirmation, because it is important to speak and to declare the things that you want to see have happen. And so we've chosen for this episode series, because it is on healing, to say, I am healed in Jesus' name, because we know that the Bible tells us that God had a process for that when he put Jesus on the cross there, and it says by his stripes we are healed. So we want to claim that healing that's available to us, and part of that is through knowledge and information, and then part of that is God also has power to heal. We've seen miracles in that way as well. So there's just that double two-edged sword kind of a thing going on there. But our power affirmation is, I am healed in Jesus' name. And so we all do our drum roll, and then on the count of 3, we just shout it out. And it is important, you know, when you speak things, you speak life or you speak death. And we want to speak life. We want to speak wellness. And so that's what we're doing here. So on your mark, get set, on your desk, your lap, your car dash, your steering wheel, wherever you are, let's do the drum roll. Here we go. 1, 2, 3. I am healed in Jesus' name.
Jesus' name.
Woo, amen. That was so powerful. Well, Ron, if you had like a wrap-up statement that you would like to share with our Epic Conqueror community regarding all the amazing things we've talked about in these 2 episodes on spine care and back health, what would be kind of your parting statement or wrap-up?
Boy, we have covered so much in 2 episodes.
True that.
Yes, I would encourage people to go to the website spinecamp.com for 2 reasons. Number 1, there's good information and resources there. And number 2, if you see something you like or you don't like or you'd like to see more of, communicate with me and let me know, because my whole role is to serve your needs. And I'm always looking to make sure that I am aware of the needs that the people I want to serve have. But I would say never give up hope. So many people I see become despondent in their dealings with back pain, feeling like they will never have the lives that they want. They feel like their power has been taken away because they've always relied on other people, and it ends up compromising them greatly. Once all hope is given up, it's like the saying, how can you make salt salty again once it's not?
Right.
I'm paraphrasing.
Yeah.
But keep that hope and know that there are always things that you can do that will make the situation better, and remain focused on those things. And even if your life is not perfect, it's going to be the best possible it can be. And that's all any of us can ask for.
Oh, that's beautiful, because hope really is an important part of the whole process, to have our hope postured in the right place. So this has been epic to have you on as a guest in our Epic Conqueror podcast. We thank you so much. And for our listeners, you know, we drop new episodes every Monday and Friday. We look forward to having you join us in those episodes and sharing them with your friends and family. We make that possible also on our Epic Conquerors Facebook page that has graphics that you can then share, because in our Epic Conquerors Facebook group, in that community, those graphics in there, you're not able to share them because it's a private community where we invite you to join us there, because we do Facebook Lives and other things in there. But on our page, there are graphics that you can share on your social media and timelines to help other people find out all this epic information that we're sharing in these episodes. So we thank you for doing that and help spread the love, spread the hope, spread the message, so that the world can be a better place. People can enjoy their lives more richer and more fuller. So on that note, Brother Ron, this has been awesome to have you here. You're like a brother to me. I feel that. I'm like your older sister.
Absolutely.
And I appreciate you so much. And thanks again for giving us your time and all this fantastic
Well,
information.
and thank you for allowing me to be a part of this. What you do is wonderful, and I'm very humbled and appreciative of it. So thanks a lot.
Thank you so much. So it's that time, people. I'm going to say ciao for now, and we'll catch you on the next podcast. All righty. Ciao for now.